Good evening, everyone, and welcome to Legacy Parent Academy. My name is Ann McHale Miller, and I'm the coordinator of social work services. We're so glad that you've joined us for tonight's presentation on destigmatizing mental health. Just some quick housekeeping reminders. This year, each of our Legacy Parent Academies are in webinar format and an hour in length. Recording will be made available and posted on our Legacy Parent Academy website by the end of the week, and it'll also include a feature that enables translation into multiple languages other than English. Also, a copy of tonight's presentation and any additional supplemental materials will also be available on our Legacy Parent Academy website. We invite those in attendance to use the Q&A to ask questions, interact with the panelists. We've saved some time at the end to hopefully be able to answer your questions. They're very, very important to us, and any questions that we don't get to or that require additional research will also be posted to our Legacy Parent Academy website along with this session. Just again, a final reminder, our last Legacy Parent Academy for the year is going to be March 24th, and it's on managing test anxiety as we get into the testing season. So after this one, we'll have one more for this year, and then hopefully look forward to gearing up for the 21-22 school year. Again, tonight's presentation is on the very important topic of destigmatizing mental health. Mental health is something that we're all experiencing and going through, particularly in light of our current situation with COVID-19 and everything that's going on in our society. So it's not only important for our students, but it's also important for us as adults, teachers, educators, and community members. I encourage that after tonight, we continue this conversation and hope that this will help to normalize the topic and we can continue to have ongoing conversations and teachings for you all in the community about this important topic. I'm very excited to introduce our panelists this evening. They're part of our Katy ISD social work team. I am fortunate to lead them, and I'm very excited for you all to see and hear from them. March is Social Work Month, so it's a great time for you to hear about this team that's relatively new to Katy ISD, and you'll be able to hear all of the amazing supports and services that they offer. So our panelists this evening are Crystal Hobson, who supports the OAC, Rains High School and BTP, Angie Kelly, who supports West Memorial Elementary, Memorial Parkway Elementary, and Galbo Elementary. Carly Kirk is the social worker for McDonald Junior High and West Memorial Junior High. And finally, Kyoko Wyrick supports our Katy Flex program, formerly our Simon Youth Academy program. So I'll turn it over to Angie. She's going to kick us off this evening. So Angie, take it away.
Good evening, everybody. Thank you so much for joining us. Like Ann said, I think this is a really important topic right now. 2020 was a doozy of the year, and 2021 said step aside. I'm going to be just as bad. So we've been through a lot this year together in the past 12 months, really almost to the date. And I think maybe one good thing that will come of it is that this topic has kind of been brought to the forefront. I think people are going to be a lot more empathetic about people struggling with their mental health. I think we've all had a lot of isolation this year, and a lot of people are dealing with added stress and anxiety and even depression. And so I think this is a great topic to cover at this time. So Ann, if you want to get us started. So this is kind of our roadmap for the night. We're going to start off with mental health at different developmental stages, and then we'll move on to signs and symptoms to look for as parents, when and how to reach out for help, and then support from the social workers in the school setting. And then we'll end with the Q&A like Ann said earlier. So my name is Angie Kelly, like she said. I'm at Galbo, West Memorial, and Memorial Parkway Elementary Schools. I also have 3 elementary age kids of my own. I have 3 boys. They're in the 5th grade and the 3rd grade and kindergarten. So I'm in it with you guys, and we'll go on from here. So I just want to start off with a general definition of what is mental health versus mental illness. And so mental health is a state of well-being in which an individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively, and is able to contribute to his or her community. It's the foundation for emotions, thinking, communication, learning, resilience, and self-esteem. And it's key to relationships as well as personal and emotional well-being. Next slide. So mental illnesses are health conditions involving significant changes, and we're going to talk more about that later. The term changes is really important, and changes in thinking, emotions, or behavior. It can be temporary, cyclical, or episodic, and onset at any stage of life. Can be cured or stabilized with medication, psychotherapy, other support systems, or a combination of the three. Can be due to social and or psychological causes. We're talking about like grief or loss of job or something like that. And then it disturbs many different functions. It can affect the senses, thinking, feeling, reasoning, volition, which is another word for like your self-determination or your will, among other things. So we're going to start off by talking about typical mental health development at different stages in life. We'll start off with preschool, go into middle childhood, preteen or tweens, adolescence, and then the teenage years. And we'll also talk about tips for caregivers along the way. So starting at birth to 3 years, we could really do a whole presentation on neurodevelopment and typical mental health development in that time frame. So much happens in those early stages of life. I think the key takeaway for parents is that those early attachments are really vital when dealing with mental health development. So just like a responsive, the nurturing caregiver that a child has plays such a key role in how their brain develops and the different pathways and connections that are formed in their brain. And so really just that responsive care from birth early on is so vital for early brain development. We're going to focus on the preschool and later just because we're dealing with school age kids. And so starting with preschool age kids, age 3 to 4, they're beginning to develop self-control and self-confidence. They still expect some tantrums at this age. They're not completely in control of their emotions, obviously, but they start to get that self-control kind of starting at this age, learning how the world works through play and exploration. They really learn through so much just through everyday living and watching you model how to handle your emotions and things like that. So next slide. For tips for caregivers. So we're going to turn everyday routines into playful learning moments. You want to follow your child's interests because they can learn best through activities that excite them the most. And so everyday routines at home, when you're making dinner, talk with them about what you're doing. When you're upset about something, kind of talk about your emotions as you're doing it. You want to model these things for your children. There at the bottom, it says a little bit of stress goes a long way. And what I mean by that is that we really need to start letting our preschoolers kind of problem solve on their own. Obviously, you can step in when they seem overly stressed with the situation, but kind of see yourself as a coach early on, but don't take over right away, so they can kind of start to learn those skills and how to solve their own problems from an early age. Next slide. So we're going to move on to middle childhood. This is kind of ages 5 through 9. They're learning self-control. By age 8, they can better mask emotions and how they cope with those things. An example of this, like I can guarantee you if we're watching a Disney movie at home and my 8-year-old starts to feel emotional or in one of those sad parts, he's gonna make some funny joke to kind of mask his emotions at that time. And so I don't know that he's upset. And so they're kind of learning how they're reacting and how to start kind of implementing like coping strategies that they see fit. They express preference for structure and routine, learning how to assert independence, even though they prefer that routine. They're learning early empathy skills. They can step into another person's shoes and kind of have knowledge about how their actions are affecting other people. So really learning those early empathy skills at this time. And then they spend less time with parents and more time with peers. They're already pulling away from mama a little bit. Okay, so tips for caregivers during this stage, really just a warm and positive parenting and reinforcement when they're in this learning stage. So when he or she comes across with moral questions, such as like lying, cheating, stealing, we're gonna give advice and encouragement. Learning how to deal with anger and other tough emotions in safe ways. And so we're coaching about deep breaths and recognizing how their bodies react to emotions and, teaching them to use how their body's reacting to those emotions as a signal that they're upset about something or whatever that may be, talking it through with them at different how they're handling those tough situations, promote respect and positive relationships, and then depending on their circumstances, expect the child's level of independence will kind of change in different environments. So really start encouraging to maybe order their own meals at a restaurant if they feel uncomfortable, work through those tough emotions where you're still helping them problem solve, but giving them a little bit of like independence at this stage. Next slide. So we're going to move on to the tween years. This is ages 10 to 12, or also you can also call this early adolescence. Commonly, they start to have emotional swings at this age, begins to rely more on same age friends. Still relies on bonds with parents, so it may not be demonstrated. They might not want to cling to you when they're in social environments. They might start to be a little bit embarrassed about mom or dad being around. That's typical for this age. Has thoughts of independence, but bonds with family are still very clear. They often think things are unfair at this age. You'll hear that a lot out of 10 to 12-year-olds. Something's not fair. So they question rules and values, and then may begin to have body image issues at this age. It tends to occur more with girls than boys, but this is when that starts happening this young even. Next slide. So tips for caregivers at this age: listen to the preteen and take his or her feelings seriously. So it might seem a little frivolous what they're worrying about at that time, but it's really important to listen to them and don't minimize the issues that are stressing them out. Work together for solutions when problems arise. Scheduled time for family connectedness. This could be a family meal at the dinner table. This could be weekend activities. They're starting to pull away from you more, but they still want to have those grounded family values. Give room for independence and identity exploration, and talk openly about teasing, bullying, and similar problems, but also the appropriate actions to take when these issues arise. So maybe at that family dinner, you're throwing out scenarios about things that might happen at school, and then you're talking it through with them. What steps would they take? What would they do? Who's a safe, trusted adult they could talk to if they were to face something while they're away from you? Next slide. So we're on to the beautiful adolescence. This was so much involved that we had to split it between two slides. So this is ages 13 to 15. They struggle with their sense of identity, and they worry about being normal or fitting in at this age. They feel awkward about their self and body image. They have all these hormones and body changes and puberty going on, and so they feel a little uncomfortable in their own skin. They still rely on connectedness with parents, but not in an open manner. So this could look like them being rude to you in front of their friends. That's typical for this age. Complains that parents interfere with their independence, begin testing rules and limits, and they develop more friendships with the opposite sex. Next slide. So they have an increased exposure to sex and drugs. They're increasingly influenced by their peers. They dress how they dress. They have the same interests as them. They're starting to find a group of peers, or trying to find a group of peers that where they feel accepted. And so this is where extracurriculars really come into play and play a big part in their lives. They kind of get with kids that are interested in the same types of things as them, like where they fit in. They commonly experience moodiness. Realize that his or her parents are not perfect, and identifies their faults. I feel like that happens earlier than this already, but next slide. So tips for caregivers: run and hide. No, you have to stick in with it. Provide an open line of communication, set clear expectations and limits, but know that they can come, like they need to know that they can come to you for anything. So a lot of things that you might talk about right now are difficult topics. We're talking like bullying or sex, drugs, gangs. We really need to start those conversations early on. Use the right verbiage when you're talking about it. Don't wait until they initiate the conversation. A lot of times, if we don't talk about these things early enough with our kids, they come home with very wrong notions about how things work in the world. And so we really want to be able to control the narrative and make sure that they have the proper information that they need on these topics. Get to know your teenage friends. This is, online if they're playing games online or anything like that, and also in person at school, anybody they're interacting with on social media. And don't overreact to clothing styles or appearance. Oh, we lost our lights. Don't overreact to clothing styles or appearance, because they're very likely to change some more over the years. Next slide. So be sensitive to identity issues, communicate and model your values about issues such as honesty, integrity, and responsibility. Just overall be sensitive and give positive feedback. Ask if you suspect a problem or anything is going on with your adolescent, and then be sure to listen and try to listen in a non-judgmental way. Just hear their problems and offer guidance, but try to give positive feedback as well. Next slide. So we're moving on to teenagers. So a lot of these points repeat from adolescence and kind of carry over to the later teenage years. Increased interest in opposite sex, test rules and limits. They're starting to choose role models at this age, both positive or negative. So kind of talk to your kids about who their role models are, who they're looking up to. May experiment with drugs and sex. Interests in clothing style are influenced by their peer groups. And the increased stress and anxiety about future choices is kind of a big deal in this age. They're starting to think about their future, what they want to do when they grow up, probably even more so with COVID and kind of all the uncertainties going on right now. So it's really important that we just provide an open line of communication and supportive environment for them. Next slide. So again, there's open line of communication, supportive environment. Don't be judgmental or disregard their ideas and plans for the future. It continues to talk about, don't overwhelm them with talks about the future, but just, start to let them explore their plans on their own and talk about that with you. Talk regularly about difficult issues. Again, set expectations and limits, but also with room for independence at this age as they're getting older, provide positive feedback. And again, it's so important. If you suspect anything going on with your teen, just ask. If it's something that you're uncomfortable with, it's okay to share that. You're a little bit uncomfortable talking about it, but just try to be open with them, share where maybe you misstepped in the past as you were growing up, and really normalize that that's part of growing up and it's all normal. And it's just a way to learn from their mistakes. So this was just kind of covering typical mental health development like throughout the childhood years. And now my colleague Kyoko is going to cover warning signs and symptoms to look for as a parent.
Thank you, Angie. So good evening. My name is Kyoko, again, social worker at Katy Flex, which is a dropout prevention school day program. Next slide. So mental illness. When we hear these words, many of us feel uneasy or uncertain because we don't understand what mental illness is. And parents also struggle with trying to understand what it looks like, right? So, and perhaps we feel a little scared based on images portrayed by Hollywood or by social media. And many adults are struggling trying to figure out the signs of mental illness in children, which result in many children not receiving treatment. So my goal for you all tonight is to understand how to recognize warning signs in mental illness in your children and how to help your child. Next slide. So even under the best circumstances, it can be hard to tell the difference between challenging behaviors and emotions that are consistent with typical child development and those that are cause for concern. A lot of times, depending on a child's age, they aren't able to state or explain their feelings or even explain their behaviors. Next slide. So I want to talk about some barriers. Concerns about when we think about the barriers, right? There's so many of them. We have stigma. We have fear of judgment from neighbors and friends or community members who may discourage treatment. We have location and transportation. Depending on a family's location, mental health resources may not be available. Of course, insurance. A lot of people have co-pays they have to meet or meet a deductible. So a lot of out-of-pocket and gaps in insurance may prevent someone from obtaining mental health services for the child. Culture and language. For example, some cultures may contribute mental illness to an issue of spirituality, and they prefer to seek out religious leaders for help. So again, there's many barriers to mental health that is not just like a one type of thing. So many things that that takes place when we're trying to figure this all out. So it's not just one person. Oh, if it's not this way, it's wrong. I know it's so many things that causes us to have these blocks when getting treatment. Next slide. So some common mental health disorders among children is anxiety. And children and adolescents with this disorder experience extreme feelings of panic, fear or discomfort in everyday situations. And some common types of anxiety is like social phobia, where they have a hard time speaking in front of people, separation anxiety, panic disorder, and just generalized anxiety. And then we have ADHD, trouble with inattention or hyperactivity or impulsivity. We have autism spectrum disorder, eating disorder, which is like a psychological condition that shows itself unhealthy and extreme eating habits. And some types, the three most common types that we know of is the bulimia nervosa, anorexia, and binge eating. Then we have depression and mood disorder. So as children with depression show behaviors that cause distress, problems in social relationships, and difficulties at school as well as at home. Symptoms can include intense sadness, being irritable or grouchy, complaints about feeling ill, and there's a lot of other ones, but those are kind of the main ones that we typically see here in school. And then PTSD, which is post-traumatic stress disorder. Some symptoms are nightmares, sleep issues, acting helpless, avoiding places, or just reliving an event over and over again, whether it be through thought or in play. Next slide. So unfortunately, too many children and youth don't get the help soon enough. And mental health disorders can prevent children and youth from succeeding in school, from making friends, or becoming independent from their parents. Children and youth with mental illness disorders may have trouble reaching their developmental milestones. So it's so important as parents, we do all that we can to address this need. Next slide. So warning signs of mental illness, again, we have mood changes, feeling of sadness that lasts at least 2 weeks or more. We have self-harm behaviors where we're deliberately harming ourselves, whether it be, cutting, burning ourselves. It can be like banging our head on different things, suicidal thought, as well as suicide attempts, behavior changes such as changes in our personalities, dangerous or out of control behaviors, frequent fights, or desire to harm someone else. Next slide. Some more signs. We have severe mood swings. This causes problem at home and at school. I know you guys have some students or, that have tested the limits often, right? Maybe getting a little bit mouthy. We have issues with sleep where they may have an increase where we're sleeping too much. Then it's a decrease where we're not getting enough sleep. They could have insomnia, just disturbed sleep where they may be falling asleep, but they can't stay asleep. Sudden loss of appetite or increase in appetite. So of course that causes weight loss or weight gain. And also one could be using frequent use of laxatives and vomiting. So more signs, trouble focusing, sitting still, poor performance in school, failing grades, increased absences, and maybe even some school suspension. Next slide. So when we think about higher risk of mental illnesses, we talked about some symptoms, but there are so many other things that can cause one to have a mental health issues. We have genetics where it can be hereditary for a person to, have this trait. It could be from the mom side, the maternal side, or the father side, the paternal side. You have increased stress environments such as family dysfunctions, where there's an environment that's a lot of fighting happening or gang-related issues. You have poverty, involvement in the criminal justice system or juvenile justice system. Next. And we also have our LGBTQ children who experience bullying in school, being picked on, not being accepted, rejection from family members because they're not able to either come out or be themselves or just talk to their family or friends or people in their family about what's going on with them or how they're being experienced or the things that they may be dealing with at school. Some kids use drugs or alcohol to try to cope with their feelings, which we all know that's horrible. And so for us, we want to make sure that we are addressing these issues early on and providing our students, our children with the best support that we can to avoid some of these issues and they feel that they have that support. So, we also have a person have witnessed some trauma. They have witnessed any type of abuse, whether it be physical abuse, sexual abuse. I mean, these are things that can be ongoing that a person may experience. Next slide. But there is good news, guys. There is good news. Early treatment can help address a child's current difficulties and can help prevent more serious problems in the future. Again, early intervention is important, and they can get some help. This can be treated. Next slide. So caring for your child's mental health is just as important as you would your child's physical health. Don't feel ashamed. Seek advice from a medical professional, your child's pediatrician, your child's primary doctor. Talk with your child's teacher. What is the child's behavior like at school, on the playground, if the child go to daycare, before or after school? Get involved, definitely asking those questions. When talking to your pediatrician, describe the behaviors and report what you observe, as well as what you learn from speaking with others. You can also ask for a referral if needed for a mental health professional who is experienced with working with children. And don't forget to share this information with your primary doctors, okay? Next slide. If your child or teen talks about suicide or harming themselves, call your doctor or local mental health crisis line. If a child's behavior is unsafe, or if a child talks about wanting to hurt themselves or someone else, definitely seek help immediately. Next slide. This is our Houston Crisis Hotline. It is 24 hours, 7 days a week. You guys can definitely utilize this line. Again, like our last slide mentioned, seeking help immediately. You can call this number. You can call 911, request a mental health officer. We also have numbers for our teams. This is a team number they can call. A lot of teams don't like to call. They prefer texting. So they can definitely text us the 281-201-4430 number. They can text 24 hours, 7 days a week, and they can get a response from a mental health professional who can assist them at that moment. I want to thank you so much for your time and giving us your evening. And now I'm going to give this over to Carly, who will discuss more available services to you guys.
Thank you, Kyoko. So like Kyoko said, I'm going to be talking to you all about when and how to reach out for help. So first and foremost, next slide, it's okay to reach out for help. I just want to pause for a minute and give you that encouragement. You're not alone in this. If you're listening and you're thinking on your child and maybe some signs and symptoms that are standing out to you, we want you to know that you don't have to be the expert in this. There are people and supports available to help you and to encourage you in this journey. Next slide. So I want to share a little bit about our district supports first off. So all of our staff is trained in mental health and in trauma-informed care. We're trained in handling student crisis. And we also have the district's response to intervention process, which allows us to identify students based on academic and behavioral needs. And so these specialized interventions could look like a lot of different things on our campuses. They could include wellness check-ins. We offer student groups like lunch bunches or specialized groups. And it could also lead to potential SPED referral as needed. Another thing that we're able to provide is referrals for outside service. So in addition to connecting with outside therapists and professionals, we're actually really excited about Katy ISD's new partnerships with some specific outside agencies so that we can connect our students to some free mental health resources and therapy and telehealth therapy as well. And then I do want to just emphasize that through it all, there is ongoing communication with our families. And so from the beginning, as students are identified all the way through the referral process, we come alongside the family with the student to see what the best potential strategies are for that specific student. Next slide. So we also have community supports available as well. So as we're in communication, we're able to refer to ongoing family support in the community. So within Katy in Houston, there are many different avenues for that. So there are outside support groups. We also have social service resources. So basic needs. We know that our children, if their basic needs aren't met, then how are they going to show up and perform well academically, or how are they going to show up and be okay emotionally? And so we saw this just recently with having water and power go out. We understand just how valuable and important our basic needs being met is. And so we're able to provide social service resources with agencies and nonprofits in the community. We can also connect with specialized individual and family therapy, as well as psychiatric services and assessments. And then we have connections with hospitalizations as well. And so we can refer families to go and get free mental health assessments. And I'll share a little bit more in a little bit about a couple of the hospitals in the area, that behavioral hospitals that provide that. And with getting the free assessment, that doesn't necessarily mean admission for a hospitalization. There are other programs available as well, including intensive outpatient programs. And so that's where a student can be involved in in-depth treatment through a behavioral hospital, but be attending school in the meantime. And so sometimes that looks like leaving early on certain school days, or an after-school program where they can be involved in groups and individualized therapy. Next slide. So I did want to take a moment to define mental health crisis and really differentiate it from ongoing mental health issues that have been discussed this evening. So a mental health crisis is formally defined as a time when there is imminent risk of a child hurting themselves or someone else. And it might also be when you or other adults in the situation can't help your child with their behavior and need help de-escalating. And so we know that this can be something overwhelming to deal with, especially with your own child. And so we do want to equip you with tools so that you can handle the crisis if needed. And we also wanted to share about how we step in during mental health crisis on our school campuses. Next slide. So we have a couple different avenues in which staff might become aware of a mental health crisis situation, and we do take all matters very seriously. So at school, a student can approach their teacher, admin, counselor, social worker with their concerns, and a mental health professional will be brought in if it's a mental health crisis, and will complete a risk assessment and take the appropriate next steps to provide support based on our district protocols. We also have some other ways for students to anonymously report. So hopefully most of you all have heard of our Speak Up app. This is Katy ISD's anonymous reporting system that enables Katy ISD students, parents, and community members to submit safety tips, safety and well-being tips. And so this is something that you can download the app for to have ready and available to you, but you can also go to the Katy ISD website to submit a tip there as well. And tips really can include a variety of different crisis situations or needs, from bullying and weapons to self-harm, or a student's concerned about their friend having suicidal thoughts and opening up about them, or even inappropriate relationships and violence and drug use as well. So this is really any concerns for the safety and well-being of a Katy ISD student can be brought here and submitted anonymously. And so they will be reviewed by Katy ISD police and admin concerning the specific school for their safety. And so that's our Speak Up app. Next slide. And then we also have the Katy Connect hotline. So if you have a secondary student, you can actually check out their ID badge, and this is printed on the back so that our students have access to this number all the time. So this is our Katy ISD specific crisis hotline. So it's available 24/7 to our secondary students who might need to talk to somebody about a problem that they're experiencing. And so in addition to the phone line, there's also texting and chat components. Like Kyoko said, sometimes we feel more comfortable that way rather than talking on the phone. And so we have that in which students can communicate their concerns. So the calls are not recorded, but they are answered by certified call counselors who are trained in responding to mental health crisis. The hotline is anonymous. However, the student can provide their information, and if the caller is at imminent risk of harm to themselves or someone else, or if there's other suspicion of abuse, then the parent will be reached out to. And if they haven't provided that information, then the police are going to be called in for assistance so that safety is taken care of. Next slide. So we also know that mental health crisis can happen at home, and we just wanted to share some specific tips for dealing with that if that were to happen at home. And these are things that we all try to utilize when we're working in the middle of a mental health crisis situation. And so we want to be sure to be direct, talk openly and matter of factly. We want to keep our voice calm and try not to skirt around the concerns that are at hand. We want to be very clear with what we're concerned about and what's going on. We want to be willing to listen, letting our students or our children talk about and show their feelings in that moment. We don't want to judge or debate with them or talk about whether their actions are necessarily right or wrong, or their feelings are good or bad, just being present in that moment with them as we're trying to de-escalate. Letting our students or our children control their space to be sure to allow them to feel heard in that time. And lastly, it's so important to seek support during and then after a crisis. So you are your child's best advocate. And I know in the middle of a crisis situation, we're able to step in and seek out that care, but we want to also be sure to connect with follow-up care as well. Next slide. So if you do feel as though your child is in extreme crisis and might need that immediate emergency service, maybe you're worried about their safety or someone else's safety, go ahead and call 911. And when you call, you can explain that your child is in the middle of a mental health crisis, and you can ask for a responder who is specifically trained in mental health issues. If you do feel comfortable in that moment to drive your child, you can go and get a free assessment from licensed professionals. So I'll share a slide as well with a couple of those behavioral hospitals that offer free assessments. And then there are also national and local 24/7 hotlines. So we have our Katy Connect hotline, and then there's some other great resources as well. I know Kyoko mentioned some of those. Next slide. So here we have a couple of the behavioral hospitals in the area. And so there's just a little information on what age they take. And so these, you can give them a call and go in for a free assessment. And like I mentioned earlier, that doesn't necessarily mean admission into hospitalization, but they will set you up with follow-up care as needed, as they recommend. And then there's also a list of a couple of the hotline numbers there as well. Next slide. And then here is the National Suicide Prevention Lifeline, which is just a good one to know and be aware of. And on their website, they have a lot of great resources as well, just to allow us to be aware of just signs to look out for. Next slide. Lastly, you are not alone. There are specific mental health professionals and resources that are put in place to help you and your student along in this journey. And Crystal is going to share next a little bit more about our team and how we as social workers are specifically available to you. Thank you.
Thank you. My name is Crystal Hobson, and I am the social worker at Rains High School, the Opportunity Awareness Center, and the Behavior Transition Program. And I'm going to talk about social workers in the school setting. Next slide. So social workers are trained mental health professionals who can assist with mental health concerns, behavioral concerns, academic and classroom support. We consult with teachers and parents, as well as administrators. We're also able to provide individual and group counseling, and we're really the link between the community and school, providing services for academic success. Next slide. And in that, with school social workers, we're here to fill the gap in between the community and school. So we're not taking the place of outside counseling resources. If your child needs that and you're in the process of looking for that, or maybe on a wait list, we can provide those individual services to students. But again, it's not to take the place or the in place of outside services. Students are at school 7 to 8 hours a day. So the issues that they're dealing with, whether it be stuff going on at home or in their friendships and relationships, they don't stop when they walk through the doors of the school. So we're really there to support them and help them through those things so they can achieve academically. Issues that you guys are going through as parents, like divorce, death of a family member or a friend, the students are dealing with as well. So we are just an extra support for them at school to help them through those things. So the role of a social worker. This infographic, when you get the resources on the website, you'll be able to click on it to make it bigger. But I'm just going to touch on a few of the things that are on the infographic. So how we work with school personnel, we provide trainings to staff for things like trauma-informed care, suicide prevention, and things like that. We're training the staff members so they know the best practices. With students, we provide services for crisis intervention, like Carly was talking about. We can do that on the campus individually. If your student is in crisis, we'll provide it. We'll complete an assessment and provide referrals to outside sources, or if there's a district level crisis. So that can be the death of a student or the death of a teacher or staff member. If that happens, we have a mental health team that would be dispatched out to that campus to provide support to all the students and staff. With families, we can provide support to families in the form of making referrals for outside counseling, as well as for basic needs. Anything you guys need, we're available to assist and make referrals for. Prevention programs district-wide, we help with those. And then again, collaboration with community resources and all the ones that Carly mentioned. Next slide. So mental health professionals in Katy ISD. So we have counselors, social workers, and LSSPs. So that middle circle is the services that we all can provide that overlap. So things like individual and group counseling, crisis intervention, and professional development to campus staff. We all provide those services. But as far as with the individuality between the three roles, the counselors are usually the first point of contact for students. Students are already meeting with counselors regularly because of schedules and things like that. So a lot of times that's going to be the first point of contact if there's any services that are needed. And if the counselor feels that they need something from the social worker or those type of services, they will pass the student along. It's going to look different on every campus. I know for my campus, we don't have as many students. So that's not typically how it works. Like I meet with students individually, and I know a lot of times if they would like to come talk to me or see me, they just ask their teacher lets myself know, and I go get them. So it can look different just based on the different campus, how many students there are, and then just the procedures that the mental health professionals have came up with. How I explain my role to students is that I'm just another support, just like the counselor and LSSP, that they can talk to if they have things going on, again, at home, in the relationships and friendships. So I'm another support for them. I also explain to them confidentiality, that anything that they tell me is confidential, that I'm not sharing it with anyone, unless they tell me that they want to hurt themselves, they want to hurt someone else, or someone is hurting them. And that is to create a safe space for the students to share and build trust. Next slide. So to wrap up and reiterate, the social work services we provide at the school are direct services to students, collaboration between the school, home, community, coordination of services for families, providing crisis intervention, and we really collaborate with other student support services like the counselor, the LSSP, staff, teachers, and then again, being in constant communication with families. So next slide. Again, this is our social work team. We are all fairly new. Anne has been here for a number of years in the district as the only social worker. Kyoko has been here this is her second year, and the rest of us, this is our first year. So we're a new department, but hopefully we can grow and continue to provide services to your students and families. And that is all we have for now. So we're going to open it up for questions.
Thanks, ladies. Let's see. Okay, so I have two questions from Sharon, who I actually happen to know. So hi, Sharon. Thanks for being here tonight. I'm glad that you are. So the first question is, will Katy ISD be moving towards having counselors at the high school level that are counselors versus the current role of counselors who are really only academic advisors? So that's a great question. We certainly know that counselors at the high school level, there's a lot of academic priorities and things that take place for them. I don't want to fully discount the fact that they do handle student crisis and do intervene, and that always takes priority over any of their academic responsibilities. But in addition to our school counselors, we also have one full-time and one part-time licensed specialist in school psychology. Yes, that are assigned to every one of our high school counselors. So I think, yes, I think if you ask this team, we would love to have more mental health professionals available. You'll see a lot of smiles and nods from these ladies, but we would love to have more mental health professionals available in the school to our students and families. And we know our high school kids are particularly at risk. So your second question of why are social workers not assigned to the high schools are where they need to be. I believe personally that we should have one at every campus, right? But I'm a little bit biased. So yes, we do understand that high school is a crucial time and where a lot of our kids are really needing a lot of those direct mental health support. So we have Crystal at the OAC and Rains High School. Kyoko supports that high school. The Simon Youth Academy Katy Flex program. We actually had a Pato high school social worker. She left us and we're getting a new one that begins on Monday. So we do have a full-time social worker that is assigned to Pato High School. The goal in our first year is really to kind of target campuses and see how the supports are impacting their behavior, how are supports impacting attendance and grades. But like everything with education, we have to wait for funding. We have to wait for a lot of different things. So I think that is our goal, is to ultimately have a social worker in addition to those counselors and LSSPs at every high school. And I can tell you that will be the target for new staff, is to cover those high schools first. But just in this new year, I've been with the district for going on 11 years. I'm super happy to have these squares on the screen with me tonight, because for 10 years I was by myself. So we are moving in a great direction. And I do think some of these partnerships that we're creating will also help provide more direct support that will allow our counselors to do that academic role in addition to providing the crisis support that they do. So Sharon, I hope I answered your question. Thank you, Sharon, for being here, and everybody else for being here. I think unless there's no more questions, we will wrap up for the evening. I'll give everybody a second. I know we just kind of threw a lot of information out at you. I think the most important thing to remember is that mental health is a topic that I know is a lot more on the forefront of everybody's minds, given that we all kind of collectively dealt with some mental health and being the pandemic and whatnot. But for us, in this Zoom and those of you out tonight, it's very important to us, and we hope that you will help us continue the conversation and normalize the fact that we all have mental health and we all need to take care of ourselves, both mentally just as well as we do physically. And there's no shame in asking for help and reaching out. And I promise that while Katy ISD may not be able to directly provide that intense mental health support within our schools, we are there and available to help walk you through it, as well as do what we can to support our students while they're with us during the school day. So if there are no other questions, I'll wrap up for the evening. Thank you again for joining us. Again, our final Legacy Parent Academy for this academic year will be on Wednesday, March 24th. The topic will be managing test anxiety. So we have a group of counselors coming to talk about how to work with those kiddos as we prepare for the STAR and EOC season that is upon us. And so we hope you will join us then. And again, this will be available on our Legacy Parent Academy webpage. So if you enjoyed it and a friend or family member wasn't able to be here, please let them know they can view it then. Ladies, thank you for your work, and we will wish everybody a good evening. Take care.